How does VEGF impact macular edema treatment? Have you ever wondered how certain proteins in our body can affect our vision? One such protein is Vascular Endothelial Growth Factor, or VEGF. This protein plays a crucial role in macular edema, especially in conditions like diabetic macular edema. VEGF increases the permeability of blood vessels in the retina. This means that fluid, proteins, and lipids can leak into the macula, which is the part of the retina responsible for sharp vision. When this happens, it leads to swelling, known as edema, and can significantly impair vision. In cases of macular edema, elevated levels of VEGF are often triggered by factors like high blood sugar, which causes oxidative stress and inflammation. VEGF also acts as an inflammatory mediator, promoting the releases of other molecules that can worsen vascular dysfunction and leakage. Additionally, in advanced retinal diseases, VEGF can lead to the formation of abnormal new blood vessels, a process known as neovascularization, which complicates the management of macular edema. Because VEGF is central to causing vascular leakage and inflammation, it becomes a primary target for treatment. Anti-VEGF therapies are designed to inhibit the activity of VEGF. By doing so, these treatments help reduce blood vessel permeability, decrease inflammation, and limit fluid accumulation in the macula. This approach has led to significant improvements for patients with macular edema, as it can reduce retinal swelling and improve or stabilize vision. Common anti-VEGF medications include ranibizumab, aflibercept, and bevacizumab. Clinical trials have shown that these drugs can effectively reduce central macular thickness and improve visual acuity, often more successfully than older treatments like laser therapy. The treatment usually involves repeated intravitreal injections, which means injections directly into the eye to keep VEGF levels suppressed and control edema. However, it is important to note that long-term anti-VEGF treatment may have complex effects. Some studies suggest that prolonged inhibition of VEGF could impair the metabolism of retinal endothelial cells and their antioxidative defenses. This could potentially lead to cellular stress and damage, which might counteract some benefits of the treatment. Despite these concerns, anti-VEGF therapy remains the standard of care due to its proven effectiveness and safety. In summary, VEGF is a key player in the vascular leakage and inflammation that underlie macular edema. Anti-VEGF treatments target this mechanism to reduce edema and improve vision. These therapies have revolutionized the management of macular edema associated with conditions like diabetic retinopathy and age-related macular degeneration. It is essential for patients receiving anti-VEGF treatment to have ongoing monitoring and personalized care from eye health professionals to achieve the best outcomes.